Hello, I'm Dr. William Berger, owner and founder of Northeast Medical Practice. We are a concierge-style internal medicine, weight management, and aesthetics practice located in Great Neck, New York on Long Island.
Good afternoon, and I'm Irina Berger. I'm a co-founder of Northeast Medical Practice, and I'm administrative director. Dr. Berger, there is and I love to do those Mythbusters videos. Um, I would like to talk. There is a myth that GLP-1 works the same for everyone. Can you talk a little bit about is it one pill for everyone? And can you tell me a little bit about what would you rely on when you choosing a proper doctor for, you know, uh, for decreasing your weight and just taking care of yourself?
Mm-hmm. Of course. So I guess I'll address the second question first. I hold a board certification through the American Board of Obesity Medicine in that specialty. I do think it's important to go to somebody who really has thorough training in the use of all of these medications, as well as all the lifestyle changes that should underlie any kind of weight management program. To address your first question about
Before you jump, and I apologize, can you tell me what does it take to obtain this board certification, and what is the, like, let's say, having the certification versus to not having, because I know a lot of med spas giving out compound right now, and you see pediatric offices, and you see the, many, it's a very big topic right now, and GLP are revolutionary in my mind. Like, they're absolutely incredible, and we see that tons of benefits for the heart and for the diabetes. Like, it's really, we see a huge impact on people, and I think this is the only first year when we heard that obesity pandemic went down. I believe it's from 42 they went to 40% right now. So tell me a little bit more about in terms of credentialing, what does it take to receive the credentialing?
Before you can enter into the process for obtaining a board certification in obesity medicine, you need to hold a board certification in one of the other general medical specialties. So mine is internal medicine, a general adult medical practice. You can come to it from other places. You can hold an internal medicine plus endocrinology, and then go for obesity medicine and so forth. The fact is that in most medical training, this specialized knowledge of the use of the medicines, the underlying physiologic and endocrinologic problems that cause obesity and drive it and make it a chronic disease, it's not included in general medical training. Currently the process involves multiple credit hours of study, typically through taking classes with an organization like the Obesity Medicine Association. That is the one that I have worked with and that I'm still a member of. And after dozens of credit hours of education with them, you need to sit for the board exam, which is a multiple hour exam, just like the boards for the other medical specialties, and the step exams during our medical training pretty much takes a whole day. And that's what you need to do in order to satisfy. And then you need to keep up with continuing medical education credits throughout the next 10-year period until you need to sit for the exam again and renew it. Some people like to just basically put their study off until it's time, the new exam is coming up that you need to recertify. I actually take a different track that they make available, where you have to read a certain number of journal articles and study to a certain degree every month in order to keep up. So that actually helps to keep you on track and current and so forth. I would do it anyway, but it's another motivator to keep me studying and up to date on everything that's new, because this is a very rapidly changing and advancing branch of medicine.
Do you believe in telemedicine?
I think that it has a place, and it can be sort of an adjunct to the in-office visit, but for the care to be solely virtual, I think is a great disservice to the patient. you know, the physical examination, in particular of the thyroid, for example, is really important, and you're not going to get at a lot of the underlying causes of obesity just by seeing the patient on your computer screen. Being able to measure waist circumference, neck circumference, because sleep apnea, obstructive sleep apnea, is directly related to neck circumference. Many things that can be missed if your care is solely virtual. Now, we do some virtual. We like our patients for weight management to come in once a month, and okay, if you can't make it this month, and be willing to do a virtual visit. The other side of this is that it's not really weight management, it's management of fat mass. It's adiposity that we're trying to decrease and maintain or increase muscle mass. So we do body composition analysis in the office with a very good bioimpedance device from a company called Sika. And of course, that's not available when patients aren't coming into the office. So I think telemedicine can be helpful in certain situations, but it shouldn't be the main way that the patient is seen.
So you mentioned about the first type. My first question was, is it one pill for for everyone? Can you talk a little bit about how do you modify for every single person? Including your exercise physiologist, and does one medication, let's say Zepbound, works for everyone, or you actually takes you some time to figure out what works, what doesn't?
So it's very patient dependent. So first of all, with any medication, there is an average weight loss response, decrease in body mass, but it's a bell curve. That average is at the top of the curve, but you have people who actually lose more than the average in the studies, and you have people who lose less, and some who lose none. There's a small percentage, 5 to 8% or so, for example, with medications like Zepbound and Wegovy, that simply don't respond. We don't yet know exactly why that is, if there are differences in the receptors that these medicines interact with, the GLP-1, the GIP receptors in those people. There's also the concept of obesity phenotypes, one called the hungry brain, where these medicines tend to work well, but if the problem with a problem that's driving the obesity is stress eating and so forth, actually some other medicines may be helpful, actually older oral medication in that case. So not only do different patients react differently to different medicines may be appropriate because of the phenotype, the factors that are actually causing the obesity for that patient. So it can be sometimes trial and error. And I think that's another reason why it's important to go to somebody who has knowledge of not just the latest and greatest, like Zepbound, which is tirzepatide, and Wegovy, which is semaglutide, and but also all of the oral medicines that have been developed over time. They can be very effective. Sometimes they can be more effective than the injectable medication for a patient because for whatever reason they're a non-responder to the newer injectable medicine, but the older oral one actually can work pretty well for them and give them 10, 12, 15% body weight loss. Sometimes it's actually necessary to add on a weight management medicine and anti-obesity medication, as we call them, and treat with two. So it's important to go to somebody who really understands how to work with them.
So what patient can anticipate when they come to you for the weight consultation and they decide to work with you? What do you usually do first?
So of course, like I do with all of our patients, a very thorough medical history about all of their chronic medical problems, what medicines they're on, their allergies, their surgeries, their family medical history, particularly important, what we call social history, which involves tobacco, alcohol, drug use, and things like that. But then also I focus on really a weight history. which involves what was their highest weight, what's worked for them in the past in terms of diet and or medication, what hasn't worked for them, how long has this been an issue, what are the social factors that could be playing into this, and of course what kind of diet are they following, their exercise, their sleep, their level of stress. Are they using any substances that we would like to minimize or eliminate? Do they live an isolated, lonely life, or do they have good social connections, family connections, all of those lifestyle pillars that we always talk about? I try to get into those deeply. And then we're going to have typically monthly medical visits where I'm checking their body composition as well as their weight and BMI, of course, making sure we have up-to-date lab work, which I often get on the initial appointment unless they've had it done recently. And then getting them plugged in with the other members of our staff, whether it be health coaching with yourself, with our exercise physiologist, Peter. I do nutrition and meal planning with patients, and these are all pick and choose. I think it's great if the patient takes advantage rather of all of the parts of our program. Some people, they feel like they have a personal trainer that they want to work with. They don't want to, even though Peter is very highly trained and much more so than your typical personal trainer at the gym. They may or may not want to begin health coaching. They feel like they don't have time, etc. But ideally, they take advantage of everything that our practice offers in terms of all of our staff.
And again, it's very customized. I mean, I know you also work with specialists. Like one patient comes into mind, she has a sister who passed away from pancreatic cancer, and the patient herself, she has pancreatic cyst. And you were speaking to her endocrinologist, basically saying, nope, I cannot give you any GLP-1.
Correct. I work, that's part of another aspect of a concierge-style practice like ours is that I have time to build really good relationships and take the time to talk to the patient specialists, endocrinology in this case, but often cardiology, gastroenterology, pain management, and also any mental health clinicians that they might interact with. And of course, we refer out to specialists when we think it's appropriate. And mental health, one of the big drivers of obesity and metabolic problems and so forth. So, if it's beyond what I think is our wheelhouse with regard to that, then we'll of course refer out to specialists whom I know and I'm able to speak to about each individual case and make sure that we're connected with what each of us is doing and so forth.
And with the exercise physiologist, I know that sometimes, Peter writes customized programs for our patients, but then, I know that you sometimes even call to the gym and you really advocating on the patient's behalf, saying, listen, our exercise physiologist said instead of 1 hour, this individual needs to work only for half an hour.
Right.
So it's on every single step of the way, we're looking at the patient and we pretty much provide the service for the benefit. And it's not one size fits all. Everybody has very, very different approaches. And again, what works for the 20-year-old, I see that might not work for 40, 50-year-old, right? It takes sometimes, we have premenopausal women who sometimes, it takes time to discover what works for them.
Exactly, and every time someone goes through a yo-yo cycle in their diet, they lose weight and then they regain it and so forth. It becomes harder and harder to lose weight after each cycle. So perhaps they might have been on a weight loss medication with another provider a couple of years ago, and then they went off it and they regained the weight. Then it becomes a little bit more challenging, and we may need to play with medicines and choose other interventions and so forth, because it gets a little bit more challenging each time a person goes through one of those cycles of weight loss and then regain.
So what would you recommend to people who looking for a weight loss clinics?
So I look for somebody who's certified by the American Board of Obesity Medicine, the ABOM. I think it's important because we really do keep up with all of the research, and we have a depth of training that some other clinicians may not have. It's not to say that people can't read and study on their own, but I'm a big proponent of formal training. When possible. And look at, of course, their reviews, talk to people who have been or are their patient if you can. Everything you would ordinarily do when searching for a physician, but I think the credential is important. More and more physicians are obtaining the ABOM certification every year, but it's still honestly a small proportion of physicians who hold this additional credential. But I would try to search out one of those physicians, and they can be found on various websites for the American Board of Obesity Medicine, the Obesity Medicine Association, the Obesity Society, the Obesity Action Coalition, which is a public advocacy organization for people with obesity. They have a list of board certified clinicians in obesity medicine.
And also the last question I have, what are your thoughts about compound medication?
So yes, this is a little bit of a hot button topic because initially these medicines like Wegovy and Zepbound, the manufacturers could not keep up with the demand for them. There was a shortage. And because of that, the FDA permitted compounding pharmacies to basically create dilutions of their own versions of these medicines. Now, there are two types of compounding pharmacies, and I don't want to disparage any of my fellow colleagues who are certified pharmacists and so forth. But in a lot of instances, there hasn't been adequate oversight in the compounding of these medicines. There's honestly, it became a very big market very quickly, and some people jumped in without, perhaps being as careful as they should. And there have been instances of people ending up in the hospital with pancreatitis and so forth due to taking 10, 20-fold times what they're supposed to of the medicine. It might be on the dilution side in the pharmacy more often because the patients weren't understanding how much to inject into themselves and so forth. But these compounds are under patent. When I say compounds, I mean the medicine itself, like tirzepatide, semaglutide. And so if it's being prepped in a pharmacy, it's not exactly the same thing as what's available from the manufacturer as an FDA-approved medication, because they hold a patent on it, and of course they put millions to billions of dollars into developing it, and so that's a trade secret in terms of exactly how they're making it and so forth.
Yeah, and it's you're talking about young girls who really aesthetically our culture is so prompt. Everybody needs to look certain way, skinny, and and they become very vulnerable, and then they see those ads on computer for $99 per month, or even $200, right? Versus regular medication costs like $1,300, right? And of course, they go for what it's a lot of times insurance does not cover, and they go for this compound not knowing what goes in there, and it's not FDA approved.
Correct.
So to your point, it's always safety comes first, right? Your health is really cannot be compromised, and when you're looking for a clinic to lose weight, I mean, to your point, to rely on credentials, right, and also factual medicine like clinical trials.
Exactly, and again, the Obesity Medicine Association, to which I belong, has issued a couple of practice statements that are essentially against the use of compounded medication, and eventually it's going to go away because we're out of the shortage period now for the FDA-approved medications, and although there's kind of a grace period and so forth, eventually those should not be available to people any longer, and with coupons and so forth, for those who don't have insurance coverage for the FDA-approved branded medications, they can decrease the price significantly. It's not to say that it's still not real money that you need to pay to get the medicine if you unfortunately don't have insurance coverage. And there are, other options. Again, if you go to somebody who's trained in it, there are some of these injectable medicines that are now coming off patent and so forth, plus all of the oral medications. So I think bottom line, go to somebody who
knows what they're doing.
Who's well trained in this particular specialty is a very good place to start.
Okay. All right. Thank you so much. This was very productive.
Well, my pleasure as always. So again, we are Northeast Medical Practice located in Great Neck, New York on Long Island. You can reach the office 516-604-3418. Our website, northeastmedicalpractice.com, our variety of social media outlets, perhaps where you're viewing this now, including our YouTube channel, and we also have a podcast on Spotify called Longevity MD, where I interview physicians about topics related to health optimization, metabolic health, and where we also post videos about other topics in medicine. All of the information that we share in these videos is for educational purposes only. We have not established yet a doctor-patient relationship, and if you have questions, concerns, problems about your health, please don't hesitate to reach out to your medical professionals. But until we see each other next time, be in good health.
Thank you. Bye-bye.